Hello, my name is Ankush Verma, and today I'm going to discuss why the world should not be afraid of HIV and AIDS. I have 5 key takeaways I want to discuss: the historical context, how the epidemic outbreaks brought about underlying anxieties, the social and political ramifications and their associated policies. I want to illustrate the social, political, and cultural dimensions of the disease, and apply the newfound knowledge towards contemporary public health debates. Starting in the 1980s, there were 5 cases of a mysterious illness popping up in previously healthy homosexual males in the Los Angeles area. These cases slowly started popping up through the 1980s in various countries and within the States. Media outlets began labeling the disease as homosexual disorder and discriminated against those with it. There were famous televangelists going on the TV yelling that God's wrath was giving this HIV crisis towards the promiscuous people. And some students were also expelled for having the virus. Later findings also found that those using syringes, such as heroin users, also contracted the virus. And during the 1980s, the terms HIV, human immunodeficiency virus, and AIDS, acquired immunodeficiency syndrome, terms were established. Now, within the 1990s, there was a great outbreak, especially from 1993 to 1995, and the US was banning individuals from participating in various activities. This soon catapulted into a worldwide phenomenon. Now, as we were learning and researching this, we found that HIV interferes with the body's ability to fight infection by attacking our immune system and immune response with the leukocytes or white blood cells. It can also be spread through blood, sexual, needle contact with an HIV positive person. And HIV can develop, if untreated, to AIDS within 8 to 10 years. And our immune system is greatly endangered to be at risk for other diseases like cancer. Now to today, ever since 2000, research has brought new antiviral treatments, and these drugs can help prolong life. UNAIDS, established by President Clinton, helped bring these drug and new social programs to underdeveloped countries. And most recently, in 2019, Lancet published a new drug under research that can stop HIV from developing into AIDS. Now, there are 4 myths that have been propagated worldwide, and the problem with these myths are they are wrong. The reality is the new medicines are helping the disease and preventing immediate death, helping to prolong people to live as long as they normally would. And there are no stereotyped HIV looks. Much of the disease is similar to pneumonia, and the symptoms are similar to it, so it's hard to tell with the sick person. And heterosexuals can get the disease because unsafe sex or mixing of blood will lead to it if there's a HIV positive person in contact. And even if you do not believe to have HIV, there's still a necessity to get tested, as the symptoms won't be established until 2 to 4 weeks after contraction. But there still exists contemporary health debates. Sex work in India still has a great spread of AIDS, with many child workers being forced to participate for livelihood with uncondom users or non-condom users. And many of them have reported contracting the illness. Now, in 2006 report in the USA, 56% of the surveyed health professionals would refuse treatment to someone with HIV and AIDS. And now in 2009, in a Kaiser family report, 40% of surveyed were uncomfortable with being in the presence of someone with HIV and AIDS. Now, political dimensions. Around 76 countries criminalized the non-disclosure of HIV and AIDS, and 21 of them would consider mother-to-children transmission illegal. War disrupts HIV and AIDS as well, given that Ukraine contributes to most of Eastern Europe's patients for HIV and AIDS, and it has effectively shut down their health clinics, so they must receive help from outside sources such as UNAIDS. And India only funds 2 cents per person for the AIDS epidemic in their research. And this country contributes to 2 million cases worldwide. There's also great South African dissidents, with the president actively suppressing UNAIDS attempts and protesters being jailed. Now, there are CDC recommendations going forward. Much of the stigmas are culture-based, so it's a necessity to change the mindset to be open towards change. It's also important to be conscientious of environments and respect people's boundaries, and this should be going without saying for health officials, as the CDC mentions, that they should follow the Hippocratic Oath. More importantly, join support groups to learn more about the disease and continue to fight the disease and work towards a cure. Thank you so much. Here are my citations, and have a wonderful day.